Stomach bug worrying experts. The CDC says it's drug resistant and hitting both adults and children.
Fox 5's Teresa Priolo joins us now with more about Shigella. Teresa, how quickly is the stomach bug spreading?
Yeah, Natasha and Steve, what I'm told by experts is that this is basically a potent stomach bug that comes with it a high fever. If you've ever lived with somebody who has gotten a stomach bug, you know it doesn't take much for it to spread. What is worrisome about Shigella is that there has been a slight uptick in the antibiotic-resistant strains, which can lead to other complications.
Shigellosis is a disease that's typified by diarrhea, abdominal cramping, and fever. Sometimes that diarrhea can be bloody, sometimes it can be mucousy, and it makes people feel really, really lousy for about a week or two.
It's the latest illness to sweep across the nation. The Shigella bacteria causing an illness called shigellosis, and it presents as a really nasty stomach bug.
These bacteria, they live with us at all times, but they typically are found in feces or the stool.
The CDC is urging all Americans to watch out for Shigella, in part because there are certain strains that appear resistant to antibiotics. The percentage of infections from the drug-resistant strains of the bacteria increased from 0 in 2015 to 5% in 2022, according to the CDC.
Where we're seeing the antimicrobial resistant Shigella are more people amongst people who are experiencing homelessness and amongst people who, men who have sex with men and people living with HIV.
The experts say your kids are most likely to get Shigella because they're always putting their hands to their mouths. But once the bacteria is introduced to your home, it is easily spread and tough to kill.
I don't think we need to raise the alarm bells just yet. Most people with this type of illness simply need supportive care, right? Fluid replacement. Make sure that your little one in particular are staying very well hydrated. With any type of diarrheal illness, the key is making sure that those individuals are not getting dehydrated.
It is worth repeating. The biggest thing with Shigella or any other gastro illness, wash your hands. And if you do get sick, make sure you stay hydrated. Natasha, back to you.
Always something. Always something. All right, Teresa, thank you.